Woman yields back the balance of her time. And I will now recognize Congresswoman Trahan for her 5 minutes.
Well, thank you, Mr. Chair. Last Tuesday, during his first State of the Union address, the president highlighted an issue I know my colleagues care deeply about, and that's youth mental health. The issue has been one of the centerpieces of my legislative agenda. In fact, in March, I joined the chair, Congressman Cardenas, to introduce Youth Mental Health and Suicide Prevention Act, legislation to support positive mental health promotion and suicide prevention programs in high schools. The bill would authorize HHS to establish a grant program for school districts to strengthen behavioral health services, awareness, and address mental health and suicide prevention needs. Additionally, I have worked with Congresswoman Castor to continually advocate for kids' safety online, aiming to create online spaces that have a positive impact on youth mental health through the Kids Internet Design and Safety Act, or KIDS. And most recently, my office has been investigating online suicide forums and the ways they encourage and provide instruction to struggling youth. These are big issues. They require new regulations, new funding streams, and agency resources. Today, we're talking about something that may feel simple to a lot of folks, changing clocks, but changing clocks can impact teen mental health, and that is what I want to explore today. Dr. Mallow, can you speak as to why a consistent sleep pattern is important for teen brain development and mental health?
Yes, thank you so much for that question. And I referenced in my written testimony a consensus statement of the American Academy of Sleep Medicine on health and the consequences for our kids. I was fortunate enough to be one of the authors on this. It was published in 2016, but I think things are even more grim these days with teen mental health. And we basically talked about what are the consequences when kids are not getting the sleep they need. And we specifically talked about mental health, including risk of self-harm, suicide thoughts, and suicide attempts. So I really appreciate you bringing this forward. When kids are sleeping better, they're less apt to take a role in risk-taking activity and suicide issues. And the best way, I think there's two simple things our country could do at either the state level with the later school start times that's been brought up by others today. And then, of course, having more light in the morning to promote sleep, which would be the permanent standard time. And I so commend you for bringing that up, because I think that the mental health of our children is critical right now.
Thank you, Doctor. Professor Calandrillo, how could extra sunlight in the evening encourage